Hi, everyone. Welcome to today's Facebook Live. I'm David Olajars, Manager of Media Relations at Henry Ford Health System. Today, we are discussing the long-term effects of COVID, also known as long haulers. These effects are real and a serious problem for many people who have been affected by COVID. Joining us for the discussion are two of our best experts on this topic, Dr. Eunice Yu, an internal medicine physician and medical director of Henry Ford's Recovery Care Program, and Dr. Omar Danoun, a neurologist and director of Henry Ford's post-COVID Neurology Clinic. Welcome to you both.
Thanks for having us.
To our viewers, please be sure to read our disclaimer at the top of this thread, which explains the intent and limitations of this information-only broadcast. With that, I'd like to begin our discussion with Dr. Yu. Dr. Yu, what does it mean when we say someone has long COVID or is a long hauler?
That's a great question because there isn't one established definition of long COVID or long hauler. The NIH a couple months ago put out an official term for capturing some of this population, and the term that they have is kind of bulky. It's called post-acute sequelae of COVID-19, and so that's an acronym that you could abbreviate as PASC. That's sort of the official line in the sand that they drew, which is to say if you're having symptoms persistent new after COVID-19 infection 12 weeks after your initial infection, then you might qualify as having PASC, or post-acute sequelae of COVID-19. Long haul COVID, long COVID, post-acute COVID, these are all terms that have been thrown around in different ways. Some people define it as even 2 weeks after an acute infection. Others are 4 weeks, others are 8 weeks. What I would say is, typically we think of viral infections as sort of having, it's not unexpected to have some persistent fatigue or feeling a little off, having a weird sense of maybe everything's tasting metallic for up to a month after an infection. It's called a post-viral syndrome, and that's typically defined as within 4 weeks of your acute infection. So we might think of some persistent symptoms as lasting 4 weeks after your acute infection.
Can you talk about what some of these symptoms are, and are there symptoms that are more rare than other symptoms that people may experience?
Yeah, that's a really great question too, because PASC is still being defined, and what we're learning about long COVID really comes from patients, from what people are experiencing and what they're reporting, and also what we're seeing show up in terms of what people are saying when they go to the doctor. The most common symptom by far is fatigue. That is in at least 60% of folks who are experiencing long COVID type symptoms. Headache is also a really common symptom. And Dr. Danoun can talk about a long list of other neurologic symptoms that patients with long COVID experience. And some other interesting symptoms that are common are really the sort of brain fog or cognitive, maybe trouble with attention type symptoms. And that's a really complicated or complex phenomenon, maybe involving the brain, maybe involving some mood or psychiatric component. And then there's some really common other things that you might not think of as life-threatening, but can be really distressing, such as hair loss, loss of taste and smell.
Do these symptoms tend to occur right after somebody is infected with COVID, or do they tend to develop at a later point?
So some patients are experiencing symptoms as soon as they sort of never get better from their acute infection. So they start feeling badly, and then they just keep feeling that same way, or maybe new things pop up. Others might feel like they're recovering, or maybe don't have that bad of an acute infection. They never go to the hospital, but then a couple weeks later they start having, a couple days or weeks later they start having new symptoms, being surprised by how they're having more trouble doing things that they used to be able to do, and noticing, maybe new symptoms that are affecting their life. So it's there's not one way that long COVID presents, but it seems to be a variety of ways. Some people experience it right away, and some people, those symptoms show up later.
Now, we know our understanding of COVID, continues to evolve, throughout this pandemic, right? Do we know exactly what causes these persistent type of symptoms?
Yeah, there's not one exact cause right now. There's a lot of theories. So those theories are actively being investigated with a large amount of NIH research funding and active collaboratives. So some of the theories include that some folks might be experiencing persistent viral, they might not be able to fully clear the virus from their body. There's some theories about viral reactivation. Just like shingles is reactivated, maybe some folks are having persistent reactivation of the virus, or maybe it's reactivating other viruses like EBV. There's also a theory about continued immune stimulation. So some people seem to be very inflamed after having COVID, and that seems to be related to some sort of dysfunctional immune responses. So there's a variety of mechanisms that are out there. And then if we talk about specific organ systems, then there might be direct damage to that organ, or maybe small areas where there's not enough blood flow for whatever reason. So there might be some specific mechanisms affecting different organs as well.
In terms of prevalence, Dr. Yu, do we have a sense of how long people are living with this long COVID? And is this exclusive to adults?
Yeah, there is not a obvious course for how folks with long COVID might experience their symptoms. We're still in the phase of characterizing what we mean by the term and what we expect to see when we call someone or when we say that somebody may be experiencing post-COVID symptoms. And so some patients really do start to see improvement after a couple months. Some patients are still experiencing persistent symptoms over a year after their initial infection. And regarding your question about kids, as we all know and are very thankful for, COVID is much less likely to make kids symptomatic. But even in some children who get the infection and aren't very symptomatic initially, they may get sick a few weeks later, days to weeks later, with a syndrome called multi-system inflammatory syndrome. And that can be fairly severe. It can present with fevers, confusion, trouble getting oxygen. And often those kids recover, but it can be very severe and striking. This is not very common, but it can happen. And there are certainly kids who are still unfortunately experiencing the effects of their initial COVID infection.
Dr. Danoun, as the director of Henry Ford's post-COVID Neurology Clinic, what kinds of symptoms are you seeing among your patients?
Well, in post-COVID neurology, we have lots of symptoms that can happen after COVID-19. There are, though, multiple main ones. The most common I see is headache. And usually patients who even did not have any headaches before, they start having headache. And then the headache starts during COVID and continues to linger afterwards. And even if they have like migraine headache, was intermittent, comes once in a while, and now they're having persistent headache every day. And then the other symptoms, which is really prevalent, really common, it is the brain fog. So brain fog is, it's a term that we to describe the problems in memory, in languages. People are having difficulty in like following conversations or remembering daily tasks, things that seamless before. So for example, somebody is trying to come up with a recipe to make a cookie. It's very simple. And then she reads the recipe and then tries to make the cookie, and like everything slips her mind. It's kind of, I think of it as like somebody holding a handful of sand, and then it's kind of like you cannot hold any information in your mind. And sometimes people are having hard time following conversations and multitasking, and generally slow to respond. So there are lots of like cognitive issues after COVID-19, and the headache and other symptoms also from the nerves in the body. So we have nerves in the hands and body everywhere. So people can have neuropathy, which is they have tingling, numbness, or even weakness in their muscles in the hands and feet and their body. And other things we can see is the autonomic system. So there is nervous control for all the internal organs, like the heart, the blood pressure, the breathing. And then that sometimes will be affected. So people will start having problems with regulating blood pressure or heart rate. So for example, somebody will be like sitting down and then stands up, and then all of a sudden will feel so dizzy because the nerves are supposed to increase the blood pressure and bump the blood to the head, and now they're failing and they're not sensing that appropriately, and people will have dizziness, they'll have lightheadedness, and all of those heart palpitation and heart racing that happens as a consequence of COVID. And it's now like I cannot stand without having like dizziness. And one of the other symptoms that we see is people having hard time focusing on tasks and completing them to the end. And people sometimes they don't internalize it. They don't realize that they even have this issue. For example, somebody is trying to kind of do their daily work and they think that they're doing a good job. But if you follow their reading or their writing or what they're doing, you will find lots of mistakes. So that's why we have to kind of like really, if you have some issues with focusing, with memory, with multitasking, just seek help and see your doctor so that we can do like a proper evaluation, because we really need to like identify those so that we can plan the treatment in the future as well.
The persistent headaches that you talked about, that's not something that can be treated with your typical over-the-counter stuff, right?
Yes, very important subject. So here's the thing. The headache happens with COVID-19, and then people will start taking headache medications, over-the-counter analgesics. And they will start helping, and then what happens is that day in and day out the headache persists, and then they start taking more and more of headache medication, and that if continues more than probably anywhere between 2 to 3 months, then that will change the headache from once in a while headache or migraine to constant and daily persistent headache. And that is really a vicious cycle. So the headache is there, and then you'll take a pain medication to stop the headache, and the pain medication will induce another headache, and it's a vicious cycle. So what we do in this, we will stop the headache medications and provide them with medications to prevent the headache from coming. What we like to do is that we like to give medication that are specific for headache. Some medication like medication we give for migraine headache that they can help, but we reserve that for like severe and bad headache, because headache usually improves with time post-COVID. And very important, do not take daily pain medications and analgesics for your headache if you're not having like really severe headache, because that will change your headache to daily, and that will be difficult to control afterwards.
One of the most common symptoms that is associated with COVID is your loss of taste and smell, right? And I gather this has got to be very frustrating for patients. Can you talk about the importance of these senses, and how can you help get these? How can you help patients get them back?
Yeah, the taste and smell are very, very important, and we do not really appreciate the taste and smell and until we lose them. And it's like, oh my God, the life is like gray and white and black and white. We cannot appreciate anything. So everything you eat, the flavor of your food, and even like the environment you're in is all processed through the nose. And then those receptors that they process the information, they can be affected by COVID-19, and patients will completely lose their sense of taste and then smell. So the taste is very primitive, like we just taste sour salty, sugary, or like sweet, but the flavor of the food is what the smell will do. So for you to understand and process the flavors, you need the smell. And COVID-19 loves that area. Will start with the nose, and it will affect the cells that are nourishing and supporting the nerves that are responsible for the taste. Usually, and smell. Usually does not affect the nerves a lot. Mostly it will affect the cells that are supportive of that. And that will cause loss of smell. And this is an issue with many people. It ranges between types of the world. Usually the percentage is about like half in general. It can be between 40 to 80% of people will lose their smell completely. The good news is that the smell will recover in about 90% within 4 weeks. So that's really good news. It will recover within 4 weeks. But there is about 10% and that smell does not recover and may take very long time to recover. So what can we do to help that? The way we treat that is the best and most proven treatment for it is the olfactory training. So how can we do olfactory training? We do 4 scents. Like you can identify anything in your closet or your house. You can get lemon, cloves, oregano, anything that has like good smell. You take it and smell it for 25 seconds and wait for 1 minute for the brain to process it. Even if you don't smell anything, just keep doing it. Go to the next smell, 25 seconds, and then wait for 1 minute and do the 4 scents in the morning and at night every day, even if you don't smell anything, and keep that going for 3 months. And this provides like stimulation for those nerves to kick back and start working again. And that is like physical therapy for the smell and taste. And most of the people will get their smell back. And unfortunately, some people will not be as sharp when the smell comes back. So I had like people who are like really like tasting coffee. They can tell like the exact taste of the coffee, and they lost their smell. And now everything to them smells bland. So, just keep doing the olfactory training and be persistent, and things will improve over time.
Dr. Yu, let's talk about the COVID Recovery Care Program at Henry Ford. Is there, and this question comes from Kristen, who's watching, is there a specific medical center within the health system dedicated for treating long-haul COVID?
Yeah, that's a great question. So when we were looking at creating a program for this population, we were really thinking about how we could serve the folks who were having continued issues with COVID in both a very accessible way, as well as one where they could access the best of Henry Ford's expertise across the system, because we know it's a multi-system disease. Like we talked about, it can have issues with fatigue, which is all over, which involves many systems, but the lungs, the heart, the nerves, the brain. So all of those things, how do we provide sort of an organized way, all these resources to our Henry Ford family? We wanted to make sure that it was based in primary care, and that's part of the CDC interim guidelines as well, which is that we know that a lot of folks with long COVID are going to need longer term care. They're going to need sort of that close relationship and that follow-up. We wanted to support primary care to be able to support their patients in terms of understanding what they were seeing, and then accessing the sort of the pathways and the expertise that we had developed within the recovery care program. So the way that we did it was by convening our experts to be able to review cases on a monthly basis, and actually look at patients who were having complex multi-system issues, and provide support and guidance for the primary care doctor and the patient together. So we don't have a single center that does this. It's more of a distributed model, so that we could maintain access, but also make sure that patients had access to the expertise that they needed in a timely manner.
Dr. Yu, I've heard this described as sort of something akin to a tumor boardroom discussion when they're discussing a patient's cancer treatment, right? So you have multiple specialists, discussing a care plan for that particular patient. Is that a fair description for the COVID recovery?
That's absolutely right. So we recognize that we wanted to look, when we were building this care model, to look at other care models that had already developed really great methods for convening multidisciplinary expertise, as well as helping patients navigate their care. So we're looking to oncology a lot, actually, in terms of how we structure our program to make sure that patients get the sort of end-to-end care that they need and feel like they have the support that they need. And our program only started in April, so there's still things that we're building out, and we want to hear from patients about what they need. We also want to hear from, so that's primarily who we want to hear from. We also want to hear from providers about how we can support them as they work with patients who have long COVID. So but that's our model. That's who we're looking to as we think about how we make sure to provide that level of support and also expertise to our patients with long COVID.
What's the trigger point for patients to contact their primary care doctor for this?
Yeah, so I think if you're wondering if you have long COVID, if you're feeling like after your COVID infection, you're not 100%, even a month or 3 months out, you're feeling like you're only operating on a daily basis at 50% or 80%, go see your primary care doctor and tell them what you're experiencing. You want to find someone who is, as with any primary care doctor, you want to make sure that you feel comfortable working with them and kind of living in that area of uncertainty, right? Because long COVID and what we're dealing with, the knowledge will continue to evolve, the therapeutics will continue to evolve, our options in terms of how we treat patients will continue to evolve. And so this is going to be a long-term relationship. We're still at the phase from the science perspective of understanding what we're dealing with. Like I said before, there's so many different possible mechanisms. And so you want someone who can partner with you and who has access through the Henry Ford health system platform to be able to continue to stay up to date and have that level of support so that you can, if your symptoms change, if your symptoms evolve, that you have the access to the rehab that you need, to the changing medications that we might be using for this condition, and have that level of access and support that you deserve.
Dr. Danoun, I'm not sure if this question from one of our viewers, Karen, is outside of your expertise or not. If somebody has underlying depression, can COVID exacerbate it?
Yes, that's an excellent question, actually, and we see this all the time. So the relationship between COVID long hauler and depression is both ways. First of all, COVID, I think of it as like adds gasoline to the fire. So whatever condition you have before, it will likely exacerbate it and makes it worse. So for example, somebody has anxiety that is like at the edge and it's not going into like the disease or the affecting daily activities, or they have mild depression, they're good with counseling and their life is good. And they get COVID-19, that will just put everything on steroids. And then usually the depression, anxiety, and other mental health issues will surface out on the surface. So yes, COVID can exacerbate mental health conditions. And the other way around, if somebody has long hauler symptoms, any of those headache and brain fog and other things, if they have untreated depression, anxiety, or PTSD, definitely that will affect their recovery. So I highly recommend, and that's what I do in the clinic. If I identify any depression, anxiety, PTSD, or any mental health conditions, I definitely would like to treat them appropriately, because that will definitely improve and help the recovery of that. Excellent question.
And Dr. Danoun, another question from one of our viewers, Michelle. behavioral health medicine is part of the recovery team, correct?
Yeah, that's right. We are multidisciplinary team. So most of the specialties are represented, and behavioral health is one of the cornerstone specialties in our team. And we do have a psychiatrist and mental health providers and speech pathologists. So we have a team of mental health providers on the team with us.
Dr. Yu, can you talk about the uniqueness of our program? We know that similar programs have been created in other parts of the country. What makes our program stand out compared to others?
Yeah, so I think there's a couple things that make our program unique. When we started, our primary interest was to serve the entire population of long COVID patients. And a lot of other long hauler clinics that have been established are really designed as research programs, and that is absolutely needed. And we are doing research as part of our program as well. But as a result of the kind of strict standards for research publication, they have certain criteria, sometimes in terms of who they can see. And because they often started with brick and mortar clinics, they had very limited resources in terms of who they could see. And so there were certain restrictions that they had, such as you had to have a documented test, and they wouldn't see you unless you had a test. And we know some folks early on in the pandemic were not able to get tests or document their infection. They may stratify based on they can only see you if you've been in the intensive care unit or hospitalized with a certain severity of initial COVID. And we also recognize that there are many folks out there, especially younger patients, who may not have been considered moderate or severe in terms of needing to go to the hospital, but certainly are experiencing a dramatic change in their quality of life after getting their COVID infection. So we wanted to serve all of those folks, and we wanted to make sure that it was accessible. That was really important for us in terms of being able to provide our resources to our population and do it not just based on who got in line, but doing it based on as soon as someone presents to primary care, that we could turn right around and see them quickly, see the folks who were complex and the multidisciplinary care in our multidisciplinary case conference in a tumor board manner.
So you talked about your primary care doctor sort of being the point person on this. So there's not a phone number, there's not a website that we can direct people to, right? You have to contact your primary care physician, right?
Yes, because we really believe that the foundation of this care is going to be through that relationship with your primary care doctor, someone who will understand what you're going through over time and be able to connect and coordinate those resources for you. Because this is going to be, this isn't a sprint, this is a marathon. And sort of, we didn't want to decenter that relationship. We wanted that to remain sort of core to how that care is provided going forward.
What about those who may not have a primary care doc? What is your recommendation for those folks?
Yeah, that's a really good question. I think the challenge without starting in primary care is that, especially if you have multiple issues from long COVID, that it can quickly get very overwhelming and confusing without having someone who knows you and knows your values, knows how you've evolved over time, to help you parse through that information, coordinate that care, tell you what's important, tell you what's not important. If somebody tells you one thing and somebody else tells you another, how do you integrate that information? That's why I think the PCP is so important. And we do have primary care doctors who are taking appointments on henryford.com. And you can even schedule, directly through that website. So that's what I'd recommend anyone who's listening who doesn't have a primary care doctor to do.
Great. Thank you. Dr. Danoun, I understand you do have a YouTube channel that you use to educate people about long COVID. Can you talk about it a little bit?
Yeah, thank you for asking that. So usually, when I started this journey, I found that there are a lot of misinformation going out there, and also the quality of information online is not high. So either it's coming from people who just share their own experience, which is usually limited and is not really like in depth, or it comes from doctors, but usually it's like the language is like really complicated and it is hard to follow. So I decided to fill in the gap and provide information that coming from the source, and share my experience with the world, and provide high quality videos that explain the symptoms and the signs and what we see with our patients, and answer it for everyone. I can see 1, 2, 5, 10 patients a day in the clinic, but I can put a video online and can be watched by thousands or even millions out there. So that's why I created my YouTube channel.
One of the things that we've seen throughout the pandemic, is the wealth of misinformation that's on social media and other unreliable sources, right? So in respect to long-haul COVID, what is your advice for people who may choose to go online to do some research about this particular issue?
Yeah, I think one of the most important thing is that when you get your information, try to get them from reliable sources, and listen to the people who have experience in this, the scientists, the doctors, and the one who really see patients. Because usually the misinformation comes from people who have like really just like very superficial information, or just heard something on the news and they just want to jump on and share it. And then you need to hear it from the sources, and that's why you should read the websites and the videos that they're really documented, and they talk about the science and back everything with evidence. That is why in our post-COVID recovery program, we're creating a whole list of information and videos that we interviewed every single part of our COVID recovery program, all the experts from the internal medicine, from psychiatry, from pulmonary, lung, all of the experts. We did interview with them, and then we have those available on the channel. So we'll be releasing them one by one. And this just provides more information for people to guide them through this tough time sometimes can be.
Is there any research underway, Dr. Danoun, to better understand long COVID?
Well, the most important one and the most reliable is the CDC website, the FDA website, and also the medical societies. For example, the Internal Medicine Society, the American Academy of Neurology, American Neurological Association. Those are reliable sources that you can get your information from. And also, so to simplify that, we did our own as well, and the hospital website. So like at Henry Ford Hospital, we have a plethora of very high quality articles about specific subjects that all of them are written by experts in the field. So we get like the best doctor in pulmonary to write an article for everyone to understand about long COVID pulmonary complications and things like that. So reliable sources that have documented and scientifically backed information is the way to go here.
Dr. Yu, this question comes from John, who's watching. Is there any evidence that long haulers experience any impact on fertility or childbirth?
That's a very interesting question. So there isn't good published data about that question. So I can't say for sure whether that impact is there. But that would certainly be, I mean, you could certainly imagine that it could affect a number of aspects of sort of the ability, depending on the severity of the long COVID symptoms, that it could certainly affect some aspects of fertility or childbirth or child rearing. So I'd have to actually at this point defer to my patient experts to find out more about that question.
Yeah, I can answer this as well, like talk about it. So yes, so like the issue of fertility was like, especially at the beginning, was raised by misinformation about the COVID vaccine causing infertility. So that's why lots of studies are trying to kind of understand this better. And there are preliminary studies found that cross-section with like so many men were studied, and then they found that the fertility of those men after contracting COVID-19 is a slightly decreased compared to the general population of their peers. This can be interpreted multiple ways, but we know that COVID is a multi-system disease and it can affect multiple organs. But I would not say that COVID is it can cause infertility, but definitely this is something we are trying to better understand.
Dr. Danoun, this question comes from Mohammed. What's the probability of occurrence of additional symptoms after you fully recover from COVID long haul?
Yeah, that's an excellent question. So the percentage of recovery and developing late onset symptoms is really dependent on I call it the brain reserve or the body reserve. For example, somebody had a healthy 20-year-old brain and had COVID-19, the likelihood of getting long hauler symptoms is lower than somebody who started with a stroke and had problems in the brain to begin with, and then had COVID-19. It is more likely to have like long-term complications and long hauler symptoms. So like your brain reserve to start with, how full is your bucket, is like that's the analogy I use. And usually we can see that as a long-term complication, and the classic example of this is parosmia. So we can talk about this. So parosmia is the change and distortion of the smell after contracting COVID-19, and it can be after like other viral illness. What happens is that when the patient loses their sense of smell and taste, then it can recover. However, the plugs will go to the wrong socket. For example, so you have areas in the brain that are responsible for tasting and smelling, for example, the rose as a rose and the rotten food as rotten food. What happens is that when the wires go back and recover the smell, it will go to the wrong socket and will start smelling roses as garbage or as rotten food. And this is really, really disturbing phenomena we see. It can happen like months after COVID-19 is recovered, and it is really disturbing for people to have it. And we treat it like we treat anosmia and other things. But this is a significant thing to have.
One final question before we kind of wrap it up here, and this could be for either Dr. Yu and or Dr. Danoun. What impact, if any, do these symptoms from long COVID have anything to do with the COVID vaccine?
Dr. Yu, go ahead.
Yeah, I think the strongest link between long COVID and the COVID vaccine is that you aren't going to get long COVID if you get the vaccine, you are dramatically less likely to get COVID, and you are therefore dramatically less likely to get long COVID. So the best thing that you can do to prevent yourself from getting long COVID is to get vaccinated. If there's a high case rate in your community, to wear a mask as much as possible and do all the things that we did to kind of prevent, that we know work to prevent the spread of the virus, in terms of being in well ventilated areas or outside, wearing masks, and getting the vaccine.
Yeah, and another thing that we think about is that for people who have long hauler symptoms, should they get the vaccine? So there are studies that specifically looked into this question and found that the majority of people with long hauler symptoms, they experience improvement in their symptoms after getting the vaccine. And we're trying to study this, why this happened. It's probably like the immune system recovery. It can lead to that, but definitely people who had long hauler, they can get vaccinated, and we recommend they get vaccinated because we don't want to get ourselves in the future with like a new variant, and then that will affect the patient will reinfect. They have like reinfection, and that will probably worsen their long hauler symptoms. So we highly recommend everyone get vaccinated. Even if you get long hauler symptoms, definitely get vaccinated to prevent future infection, and maybe you can recover your symptoms or help at least improving them.
Thank you for that thoughtful insight. One last question for each of you, and Dr. Danoun, I'd like for you to take first shot at this. Is what your final thoughts on our discussion today? What key message would you like to leave for our viewers?
Yeah, thank you for that. And I think the most important thing is that what I see is that people sometimes they're suffering in silence. Like that's what we called it the other day, suffer in silence. So don't suffer in silence. Look at your, if you have symptoms of headache, if you have brain fog or any problems with your memory or multitasking, reach out to your doctor, reach out to your primary care doctor, see a neurologist or a specialist, because they will have a cure or a treatment for you that you might not be even like accessing if you did not even like seek medical attention. So definitely if you are suffering or having any symptoms, reach out to your providers and hopefully you can get an answer there.
And Dr. Yu?
Yeah, I think the big takeaway from me in getting to know a lot of patients who are dealing with long COVID symptoms is that, it's so important to have a partner, a primary care partner, someone who can continue to walk with you as you manage the ups and downs of this condition. Many folks who have long COVID will continue to get better over time, but there's going to be some ups and downs along the way. And this is so new in terms of what we're dealing with, and it can feel very frustrating and hopeless because there isn't, besides vaccination, there's not one sort of magic bullet that seems to have wiped away long COVID symptoms for a large group of patients who are having these symptoms. So in terms of, for a lot of folks with long COVID, they may have never been ill before or never seriously ill before. And now they're dealing with something that is affecting not just how they feel, or not just, a specific symptom like not being able to taste and smell, but their actual ability to do things in their daily life, their ability to go to work, their ability to interact with their family or do social activities. And that can be a really huge shift. And getting through that really requires a whole team around you. That team at the center, really, you want to find someone who can help you build that team. And the person who can help you do that is in primary care with the right supports. And I think at Henry Ford, what we really try to do is to build that support out for our teams. So like Dr. Danoun said, seek out help and get that team for you so that you can start to get better.
Doctors, I want to thank you for all your insight and expertise about this important topic today. You've really provided a wealth of valuable information to our viewers. We also want to thank our viewers for tuning in, and we will look for you next time on our next Facebook Live. Please be safe out there. Remember to wear your mask. And for those who have not yet already done so, please go get your vaccination. Have a good afternoon, everybody.